Now look at the next bone which we'll be looking at is clinical importance. Clinical importance is more of like trying to establish a reason why we study the anatomy of this particular bone. So this is the frontal bone, okay, being the bone in the front of the skull. So why do we study this bone? So we'll talk about fractures, we'll talk about frontal sinus infections, we'll talk about surgical access to the brain. So this frontal sinus infection is basically sinusitis. So the frontal bone, you should know that it forms the forehead. That's also the roof of the orbit. That's the eye. Okay, on top of the eye here is the frontal bone, and also part of the anterior cranial fossa. So it could be affected by fractures where there's break in the frontal bone, and most of the times is due to high energy trauma, road traffic accident, assault. So clinical features is you see a clear deformity in the forehead. You can see swelling and pain. So possible the cerebrospinal fluid could leak if the fracture extends to the anterior cranial fossa. Then there's also risks of intracranial injury because it's close to the brain. Okay, so usually evaluate that using the CT scan to look at the damage and the extent. Then we have sinusitis, which is inflammation of the sinuses. I know we have sinuses that are actually into the frontal, that's a frontal bone. So you have pain that is radiating right into the frontal bone, and you can feel the pain over the front of your head. So there's frontal headaches, tenderness over the forehead, nasal congestion, and sometimes you have pus accumulation which can be discharged. So in severe cases could lead to orbital cellulitis or intracranial spread, where the infection is kind of like spreading inside the brain. So importance is chronic or complicated frontal sinusitis may require surgical drainage. Then we have surgical access to the brain. You can follow through the frontal bone to access the brain. So it forms part of the anterior cranial fossa and the orbital roof, and provides a surgical corridor. It's like a surgical walkway through which you can access the brain. So all those craniotomies through the frontal bone allows access to the frontal lobes. So if there's a tumor there, meningiomas, pituitary tumors, you can follow through here and access the brain. So that's what we have for the frontal bone. These are the several reasons why we study the anatomy of this bone.